She was wearing her white coat. So, sorry, she's in white coat, but you will see some of the pictures, the current pictures, at least in Washtenaw County, to see how it's more a holistic approach. So not a sterile environment like a institutional setting. Um, Program delivery, WIC operates through mostly local health agencies in about 10,000 clinic sites in all 50 health departments in the state of Michigan. The important statistic I did want to mention is WIC serves 53% of all infants born in the United States. That's huge because that's more than half of the babies that are born in the US are on the WIC program. Examples where WIC services are provided, definitely county health departments, like Washtenaw County WIC program is part of the county health department. Hospitals, mobile clinics, vans. We're going to discuss that with our management as well. Long term, we could do something like that in addition to our main hub clinic in the Ypsilanti office. We also partner up with community centers, schools like the Head Start program, public housing sites, migrant health centers, and Indian Health Services. So clients are encouraged to participate. The difference between SNAP and WIC. Unfortunately, the EBT card looks identical, so there's always a little bit of confusion between both the programs. So we did talk to the clients that they can be on both programs at the same time. The difference, though, is WIC is no age limit. SNAP is no age limit for food stamps. However, WIC has an age in the category limit, so it has to be women that are pregnant or postpartum, infants, and children up to age 5. SNAP does not have nutrition education component. Anything that's food can be purchased. So even I heard sodas and other items could be purchased. But with WIC, they're defined foods. They're nutritionally catered for this vulnerable age group, and they're packaged to meet the nutritional needs during that special periods of their lives. And then we have, within the state of Michigan, we have 48 WIC programs in the county that work under the health department. These are some, just to show you, this is not an accurate, I'm sure the Medicaid data is different now. But with WIC, family of 4 that's making $48,000 a year or less are eligible to be on the WIC program, versus annual income guidelines for Medicaid is they have to be at or below 34,000. So right off the bat, if they're receiving Medicaid, they're definitely eligible for WIC. So a mom with the number of a pregnant woman is counted as 1 plus the number of infants she's expecting. So if she is pregnant with twins and has 1 child, she's considered a family of 4. So just to give you an idea, so it's a very lenient program in terms of income eligibility. Monthly participation for the Washtenaw County WIC program, just so you guys have an idea of how many people we serve. Our caseload is close to 5,000 participants, all of it. Our biggest chunk of the population that we serve is children. That's close to 3,000 children. That's because they're on the program from ages 1 up until 5. And then the next highest population is our infants, anywhere from ages birth to 1 year. I do have the little acronyms in here. IBE is infants breastfeeding exclusively, infants breastfeeding partially, infants formula feeding. That's our biggest population, but we're trying to work to get these numbers up as well, breastfeeding exclusivity. So we'll talk about that in the future slides, but about 240 non-breastfeeding moms and 300 breastfeeding moms, 385. So the next highest population is postpartum, and then is the breastfeeding. During the pandemic, how did we do? We're still counting. Our caseloads actually climbed up during the pandemic. This is the curve starting March 16th of 2020 to March 2021. Notice the curve just beautifully went up. We've been operating in a hybrid style. Staff come in the office 2 days a week and work remotely 3 days a week. At this time, clients are offered services virtually only and also via curbside pickup of their EBT cards or essential WIC items. Did anyone talk to me? Did anyone have a question? Okay, so the remote operations are going to continue until July 12th. I'm sorry, August 1st, and we're going to start to reopen to clients from August 1st, first Monday, that Monday of August, where we're going to gradually like start with pregnant moms and then postpartum moms and then move up to children and so forth. We're averaging about 98% of the assigned caseload over the past year, which is above the required 97%. So we're good with our statistics, the metrics that the state requires and the feds require for us to maintain our maintain our funding. WIC makes a difference. I'd love for you guys to know this is pregnant women served by WIC enter prenatal care earlier. That improves their diet, lowers the smoking rates, and has positive effect on the outcomes, pregnancy outcomes. Pregnant mom enrolled in WIC prenatally will have better outcomes. They have decreased preterm babies, decreased low birth weight babies, decreased infant mortality and morbidity. And pregnant women in general have, if they're enrolled in the WIC program prenatally, are more likely to initiate and sustain breastfeeding for longer duration. So breastfeeding is a huge thing that WIC, as a maternal program, infant program, we promote breastfeeding as a superior infant nutrition. Participation in WIC reduces infant mortality. We mentioned that before. It fights poor or inadequate nutrition. WIC children are better immunized and have a regular medical home to go to. WIC children do better on vocabulary scores as well. These are all based off of the statistics that WIC on a regular basis kind of monitors. WIC is a wise investment. Every dollar spent on WIC saves about $3.50 in subsequent healthcare costs. And this is our, again, the source is Michigan Department of Health and Human Services that does the data evaluation. Just to give you an idea, WIC also boosts the economy in our community. In 2020, the Washtenaw County Health Department's WIC program provided about over $2 million in WIC foods that were redeemed in the county, and about 43 authorized WIC vendors, which would be our major grocery stores, and some dairy marts and gas station marts, and there are some Family Dollar stores, I believe, that are also authorized WIC vendors. So we have a list of them. What does WIC do? This is the, I'm not sure how many of you are familiar with. Our primary goal is disease prevention. And so nutrition education is the most important thing. One-on-one counseling by registered dietitians, EBT bridge card to buy healthy foods, support and help with breastfeeding, referrals to Medicaid, SNAP, parenting classes, healthcare immunizations, Head Start, preschool, and many other programs. So nutrition education comprises many different areas: breastfeeding, definitely, infant feeding, prenatal weight gain, anemia. These are just some examples for you. WIC dietitians, what do? They're the healthcare workers, use motivational style interviewing, provide a lot of empowerment to the families, and they provide client-centered education. So it's not that they walk in with an agenda, oh, your child's overweight or anything like that. They try to understand where the mom is for the learning opportunity. And then they do parenting practices. They assess the parenting practices, screen time, possible neglect and abuse of the child. One of the top public health issues is overweight and obesity prevention, and WIC addresses that as well. WIC talks about portion distortion, portion control, lifestyle, encourages family meals, discusses about promoting responsible fatherhood. Pre-COVID, we used to have Dad's Cafe in partnership with our Head Start and Trusted Parent Advisor Group from Head Start for pre-WISD programs. So one of the WISD programs. We'd love to get back to that once again after this COVID kind of settles down a little bit. Breastfeeding, again, there are lots of studies promoting the health, mental health, nutritional, economical, emotional, multiple different benefits for both mother and babies. Now, if we were to look at statistics, about 90% of the US families could comply with medical recommendations to breastfeed exclusively for the first 6 months, United States will save about $13 billion per year and prevent an excess of 911 deaths, nearly all of which would be infants. And that's just a huge statistics. And that's one of the reasons WIC emphasizes breastfeeding so much. Breastfeeding lowers obesity rates. Earlier slide, we looked at how that is one of the big public health crises that we have. Michigan has been one of the top 10 heaviest states for many years, although currently we're ranked as 18th heaviest state. So we went down, so that's good news. We do spend, United States spends a lot of money, as much as $147 billion annually on the direct or indirect medical costs related to obesity. So that would be, like diabetes, high blood pressure, and related complications with those chronic conditions. These are some of the studies. I'm not going to go over them individually, but these are all published not too long ago, indicating how breastfeeding and breast milk is such a superior infant nutrition for children, for infants. So it promotes intake, and bottle-fed babies are more less likely to be overfed, and breastfed babies are less likely to be overfed. Bottle-fed babies have, they don't have the ability to say stop, so they're going to be either drinking or drowning, and so that creates overfeeding pattern. And formula is very high in protein versus breast milk is rich in fat, which is the important nutrient for their brain cell development and so forth. So these are more benefits that talk about how breast milk is a live bioactive substance. One of the trainings I went to that was really cool, where we got to look at a drop of breast milk under a microscope with live cells moving around, and then you take a drop of formula, it's a dead substance. There's no life substance in there. So, breast milk provides contains a lot of immune cells, WBCs, that protect not just for immunity. Some are also known to protect from tumors developing. So that means they can protect from cancer too. So these are some facts that I picked out from the studies, and I thought that was very interesting. The infant gut takes up to 2 weeks to recover from damage caused by a reaction to a single bottle of artificial baby milk. And that human alpha-lactalbumin in lab experiments was found to inactivate at least 40 forms of tumors, so cancer prevention, big time. And then this is really cute, how survival instincts for cows is to be on their fours within 4 hours after birth, so their milk is designed for that. So that's why they're so rich in protein, right? But however, human babies' survival instincts is their brain. Their fontanelles usually close around age 22 months. And so their neurons need to be myelinated, and those nutrients are present in breast milk and not in formula. So that's why human babies need human milk and not the formula. Research also shows that breastfeeding can increase a baby's brain growth development by 20 to 30%. So they're higher potential in terms of IQ. Where do we stand for our breastfeeding rates? This is Washtenaw County, looked good until 2020. Of course, the pandemic hit. It's starting to drop. We're working on, getting those numbers back up where we've got our task force. We also have established many programs like Spanish support group. We have a Ramadan support group, Black Mothers Breastfeeding Social. We're trying all areas of our, that we want to see improvements in. So that's where we're at in terms of initiation rate. But initiation rate in general, we're 70 to 80%, which is really cool. That means 80% of the babies that are born are breastfeeding, 75% right now. This here, state WIC, and yellow is Washtenaw County WIC. We're definitely, Washtenaw County is ahead on the curve in terms of the statistics for breastfeeding initiation rate at 2 months, at 6 months, at 12 months. I mean, you just see how the rates drop significantly. So a lot of moms are enthusiastic initiating breastfeeding. However, something goes wrong. And of course, there are multiple factors that influence when we look at the data, like moms may have to return to work, not have adequate support, and so forth. Sorry. What do we do in WIC office? All staff receive training exclusively. Breastfeeding friendly language is used all times, where staff ask, how is breastfeeding going, as opposed to asking them, are you going to breastfeed or formula feed? That makes the mother feel like they're both equal. They're not. So by asking an open-ended question opens up conversation, so then the staff can talk to them about it. What are your thoughts about breastfeeding, instead of asking, are you going to breastfeed your baby? and so forth. We also have pace bottle feeding. If the mom does choose to breast formula feed for medical reasons or anything like that, how do we pace the baby so baby is not overfed? You know, the slide that you have seen in the past. Standardized messaging. We're partnered with other community members in our county to be able to get those standard messages out. Breast pumps. WIC does provide multiple different kinds of breast pumps, teaches assembly, breast milk storage guidelines, lots of stuff. This is the video. We're not going to watch that right now. And this is one of the partnerships that we have in providing that consistent messaging with the local hospital, birthing hospital partners. So all moms get same message about breastfeeding in terms of initiating, in terms of sustaining breastfeeding. We also have breastfeeding peer counselor program that peer counselors are mothers who provide support, answer questions, and help with referrals. We call them our cheerleaders. But they're not IBCLCs. They're not international board certified lactation consultants who can provide a little bit more in-depth lactation management, but they have limited scope that they're more supporting and cheering the mother to be continuing to breastfeed. So literally mother to mother support. These are our current breastfeeding peer counselors. I'm always proud of the expertise they offer, each one of them offer. Erica here is certified baby carrier, is a teacher, so she teaches how to carry the babies. She's also our certified sign language interpreter. Dara Williams, she's had experience of her own being teen mom and is a mother of 3 children herself, and she has nursed every one of them, and she's really awesome, reaching out to population, when it comes to teen pregnancy and challenges. Shayla here, she speaks Spanish and English, and she runs our Spanish support group. Gretchen here talks about our Muslim moms Ramadan support group. And then that's them. We also have annually, we host some celebrations. Like I said, multiple support groups and so forth. We work with our local hospitals to receive the designation of BFHI, which is UNICEF, World Health Organization, and UNICEF designed designation for the local birthing hospitals. And in Washtenaw County, St. Joseph Hospital recently received that designation. So they have to follow these 10 specific steps in order for them to get that designation. University of Michigan is not yet there. So this is a little bit, I have a few pictures on here that just shows how our staff members, we in Washtenaw County WIC program specifically have passed a policy under the guidance of our county commissioners that WIC employees can bring their babies to work because that's what they're doing on a daily basis. It's just, leading by example, basically. So there are some of our staff members. She's Gretchen, and this is our client with her baby. So it's been a win-win situation. So there's some of the employees with their babies and clients also. Like I mentioned, they talk about varying babies for both dads and moms. So again, our peer counselor, our dietitian, these are all our clients, who just loved learning that baby wearing. These are events pre-COVID, but we do have lots of celebratory events during World Breastfeeding Week. Not sure how many of you guys are familiar, but August is the month of World Breastfeeding celebration. So I recruit my children to come in. Well, they're not children anymore, they're adults, but they come in and help with some of the events, face painting, issuing Project Fresh, reading books, henna. So they do all of these as well. So just going to food packages. The food packages customized per participant, looking at their needs and goals. So partially breastfeeding moms shelf looks like this. Exclusive breastfeeding moms shelf looks like this, and this is the formula fed baby. Now, formula is also on there, but it's not coming with all the medical health benefits that the babies receive when they're breastfeeding. So roughly about, if you were to put the dollar amount, partial breastfeeding gives about 134, exclusive gives about $200,000+ per month. Food for infants, iron fortified formula is available for those babies in the first year of life if they're if they cannot breastfeed. So definitely WIC provides formula but we encourage breastfeeding if at all possible. Breastfed babies actually receive jarred meats as well at 6 months, in addition to other jar foods. WIC is a supplemental food program, meaning it doesn't cover the entire needs of the family. So if they're on formula, unfortunately, they do end up have to purchase some formula out of their own pocket. So that costs about up to $60 per month. So another reason why we consistently encourage breastfeeding is there's no out-of-pocket costs. Women and children, the basic food groups are covered, like dairy products, eggs, cereal, whole grains, fresh fruits and vegetables, juice, and so forth. Now, this has been temporary per President Biden's American Rescue Plan Act of 2021. There has been an increase of dollar amount for the moms to be able to purchase at the grocery store. This is for both mothers and children 1 to 5 years. So now they have $35 per month to purchase. It's temporary. It ends on August 31st, but it's from May to August 31st, a couple of months. Project Fresh is our summer program where clients receive $25 per participant, up to 2 participants per family, so $50 if they have 2 eligible participants. It's really neat. It promotes both the farmers as well as encourages families to eat healthy foods. We work together, to improve our community health. So partnerships are so critical. We all know that, and that's why we're partnered with our Head Start early on high schools and daycare centers, local pediatricians, obstetricians, prenatal clinics, maternal infant health program, local birthing hospitals, and Medicaid SNAP programs, and many other programs like pregnancy screening programs and so forth. These are our 4 satellite clinic locations. Again, with COVID and pandemic, we have all of these closed. Only clinic that we're operating from and mostly remotely is our Towner Health building. So otherwise, we have a clinic in west side of Ann Arbor. We borrow space at the Calvary United Methodist Church. We may be moving from there because the church is going through some major renovations themselves. And then WIC, Washtenaw County Community Mental Health, that's off of Ellsworth, sort of southeast of Ann Arbor, sorry. Emmanuel United Methodist Church, that's Manchester, and then WIC Head Start in at Beatty Early Learning Center. These we call them pop-up as needed. Again, it was pre-COVID. We haven't done anything since COVID. Ann Arbor Preschool, Whitmore Lake Head Start, and so forth. Outreach, it's so important. We do outreach within our program too. We've taken our staff to our partner agencies. Eventually, we'd love to bring them to Head Start, and other programs. Of course, COVID hit. This was September of 2019, and we were going to have one in April. We could do 2 maybe a year, and we were hoping we could rotate our partners. And our first one was at St. Joe's. It was a very successful tour where they got the tour of the hospital, birthing center. Staff enjoyed being offsite. They got to see what the clients go through. So, and then the hospital staff get to see the WIC program as well. So it's win-win situation for everyone. So we do a lot of staff wellness emphasis, and we've done other outreach activities like WEMU had a presentation interview on the radio about Black moms being able to have the equal opportunity in the breastfeeding area. We dress up during Halloween. Again, this is pre-COVID. Some of the pictures. This is our clinic, by the way. As we merge out of COVID, definitely I'd love to invite our partners to come into our office too. This is a video I just wanted to share with you guys.
Hi guys, this is Michael. Sorry.
Can you guys hear it?
We can, but it sounds like it's going through your speaker.
So not very clearly. You can't hear very clearly, Amber?
No, it's not very clear.
Okay, let's just skip it then.
Hi
Oops.
guys.
2021, we had a management evaluation. That's our accreditation, part of Washtenaw County Health Department accreditation, but that's an audit for our program by the state health department. And we're proud to announce that Washtenaw County WIC passed its evaluation with 0 citations in the, I don't know, I think it's been 35, 40 years since Washtenaw County WIC has been established, and I'm really happy about that. So I just wanted to share that we had no citations. It happens once every 2 years, so we're good for another 2 years. In the midst of the pandemic, we had the audit as well. Any questions for me?
I guess I had a question. I guess first off, thanks for all that very informative information. Just obviously from a male's perspective, I'm not that familiar with the program. But I guess it made me curious as to are there any programs. Obviously men cannot breastfeed at all. Men aren't built like women in that regard. But in terms of the food packages or whatnot, I guess are there programs for dads with young children? Because obviously they have the same need for youth ages 1 to 5. I know SNAP exists, but I guess I was just curious if there's any role for men in this program.
Great question. I should put that as a slide. Men can bring their kids to the program as well. We do have, but there is no nutrition.
Hello?
Can
He's
you
there,
hear me?
isn't he?
Yeah, I'm looking on.
Is he?
I'm trying to listen to my voicemail.
I just said, is the guy there? Damn.
Sorry, can you guys hear me?
Sorry about that. I think someone was unmuted.
Okay, never mind. So I'm sorry, who was the guy who asked me the question? I didn't catch his name.
That was me. I'm sorry, I didn't introduce myself. My name is Aaron. I'm with United Way of South Michigan.
Yes. Hi, Aaron. So that was a wonderful question. Fathers are eligible to bring their children under age 5 to the WIC program. They themselves are not at this time eligible for this particular program to receive benefits because women are eligible because of the nutritional needs, added nutritional needs during pregnancy and the vulnerability period of their time. So, and postpartum. So the postpartum moms that are not breastfeeding, they're eligible for 6 months after the baby is born because of their increased nutritional needs. And then women who are pregnant because their calcium needs are different, their folic acid needs are different, to make sure that the babies that are being born aren't born with any birth defects like neural tube defects, folic acid deficiency or calcium deficiency and things like that. So that's why the pregnant woman and the postpartum women are eligible. Not all other women are eligible. Moms with older children are not eligible unless they're in that vulnerable age period, they're eligible. Okay. But fathers absolutely can bring their kids to the WIC program as well. We do have foster care parents, foster care fathers, and that bring their children to the WIC program. Hope that answered your question.
We also have a question from Emily.
Okay.
She wants to know if the application for this is on Michigan Bridges.
Yes, it is. My Bridges has the application. A very good question. Thanks, Emily. It's the application, it triggers, by when they answer the questions. I don't have the exact knowledge on what questions trigger the WIC application, but as far as I know from my state MDHHS WIC partners, that there are many questions that triggers WIC application for them, and they apply. We get about 5 to 10 applications a day that we process. Anyone from Head Start or preschool or WISD that may have any questions for me? Okay.
Thank you so much for your presentation, Gayatri. Next, we're going to have Charles Wilson from the Department of Health. Whenever you're ready, Charles.
Right. Good afternoon, everyone. I'm gonna share my screen here and get us started with the presentation. Oh, it's not supposed to be there. Okay, perfect. All right, how do I move this? Move that there. Okay. So once again, my name is Charles Wilson, and I work for the Health Department here in Washtenaw County, where I serve as our Community Health Promotion Supervisor. And I've been with the Health Department now for, 21 years now, since 2000, so it's been a while. And so today I'm going to give a really brief update on our summer outreach COVID-19 vaccine efforts. And so I'll go ahead and get started. So just some recent updates to go through. For many folks on this call, this information will be somewhat redundant given the fast nature of our news cycle. But if you don't know, all recent epidemic orders have been removed. Masking still recommended indoors, even if unvaccinated, just as a precaution. Healthcare settings have different requirements. Also, businesses and nonprofits can still require masking. And I think that's important because often what will happen is that given that there's no state orders anymore, people will go into businesses and maybe think, well, I don't have to wear a mask. And then that business actually requires a mask. And so it's important to understand and share with your networks that businesses and nonprofits can still require masking. Also, businesses and nonprofits can ask staff about vaccinations as well. They do have the authority to do that. And anyone 12 and older can now get vaccinated and should not be denied due to lack of insurance or documentation. Now, this graph, you can't see all of the actual details on this, but I think what's important to remember are there are a couple things to remember. Let's start with the great news, and that's that, as you can see here, 65, I can use my cursor like Gayatri did. You can see 65 to 74-year-olds, 90%. They've already been vaccinated. And essentially, well, let me go back and say that these percentages are based on folks who have received at least one of a 2-dose vaccination. Obviously, with Johnson & Johnson, that wouldn't apply. With our 75 years and older folks, it's at 88.4%. So we're actually doing pretty well. But let's talk a little bit about where we have areas to make improvement. There'll be another slide after this that'll detail this a little bit more. But as you can see, it's our 16 to 30-year-olds really where we really want to really see our vaccine uptake a little bit higher. And the whole idea, for folks who weren't aware, is to get everybody at 70%. So that's really I don't want to call it the magic number, but it's the benchmark that we've set for ourselves. And I believe that our goal or our time frame for that goal is, I want to say September this fall, or later on this fall. So what I'm going to be talking about as we move past this slide is our local efforts in order to get these numbers higher. So I talked a little bit about this. Where are we doing well? Over 50, we're obviously doing well. With our 12 to 15 years old, we're the #1 county in terms of having this age group have at least one vaccine, one shot. Our geographic areas we're doing really well in the outer ring of Ann Arbor and Chelsea, and we're really doing well with women as well. Here, in terms of where we can make progress, I talked about this earlier, under 40. You saw that graphic in terms of where we are with particularly our 16 to 30-year-olds. Our geographic areas, the 4 corners of the county and parts of Ypsilanti and Pittsfield townships, and then the student areas of Ann Arbor and Ypsilanti. And then from a gender standpoint, we really want to start to do a little bit better with our men. I worked for many months this winter at our mass clinic. Many of you all may be aware of that over at EMU. And I did notice the contrast between the number of men, regardless of age, of I should say males, who came in as opposed to females. And this data here bears this out. And so that's another area or another target group for us as well. So what we're going to be using are pop-up clinics and vax teams. And so let me go back and talk a little bit about why we're using this particular strategy. So for many months, as I mentioned before, we actually were doing most of our, if not basically a large percentage of our vaccinations at either EMU, at the Convocation Center for the last 6 months. That's beginning to wind down now. And then we were also out at Pierce Lake Elementary over in Chelsea. Well, that strategy has changed, particularly in these areas amongst these groups where our vaccine uptake has been a little bit lower. And in order to be more intentional about that, we've started using these pop-up clinics. And essentially what it is that we're going to the communities where people are, particularly where the vaccine uptake is a little bit lower. Well, I should say lower in general. And that removes the access barrier. I mentioned in an earlier slide that the ability to pay or access should not be limited to anyone in this county. And so our remedy for that is to create or really work with partners. And I'll be talking about that in a future slide. To work with our partners to really get to these areas and get access to the vast networks that our partners have in order to really get that vaccine to people who, for quite frankly, either weren't eligible during the time that we were at EMU, or that EMU and the elementary school in Chelsea just wasn't accessible to them. Or maybe it was accessible, but the times that we held the clinics weren't amenable to some folks. And so these pop-up clinics are a way to do that. And so we understand, though, that these pop-up clinics in communities are going to be much smaller. And just to give you just an idea, when we were at EMU, I think at our height, we were running maybe 1,400 people a day. And so with these these pop-up clinics, I mean, if we get 50, that is absolutely extraordinary. That would be spectacular. But we're not expecting to get 50. If we can get 10 to 20 people during a 3-hour time frame, particularly during the evening when people are getting off work, that's considered a success. As you can see here, we have a couple of pictures at some of our recent pop-up clinics at the Ypsilanti High School, and also over at Whitmore Lake High School. We did a clinic over there as well. So as I mentioned earlier, these VAX teams and these pop-up clinics are based on partnerships. And we have established a number of partnerships prior to COVID and during the pandemic that have been absolutely instrumental in helping us get feedback from community members about not only vaccine and barriers to vaccine, but also service delivery on the part of the health department. And we'll continue to rely on these various partnerships in order to get the vaccine to these groups where the uptake is a little bit lower. As you can see here, there's a 108-year-old getting her second shot. Looks like, and then we have a poster here from St. Francis pop-up for the Latinx community. And then you have a drive-through clinic that we did. I want to say this was at one of the churches over in West Willow, although I could be wrong about that. And so partnering with Latinx community, faith leaders, those in the African-American community, as well as working with our Racial Equity Office, which is REO there, and schools and businesses will help us tremendously in getting all of those, getting everyone to that 70% threshold. So what are our goals? I mentioned earlier, we're data-driven. We want to get every census tract over 70%. We want to continue to develop and strengthen relationships and work in partnerships. We want to make it convenient. We want to go where people are either going to be or they're going anyway, and then move people from along that stage of change continuum to not yet to yes. And I think one of the things before I go on to the next slide is that as we're coming out of COVID, because that's essentially what we're doing, this strategy of taking this service delivery model into communities is not just strictly confined to COVID vaccine or COVID testing. This is a strategy that the health department is dedicated to using in order to really increase our reach but more importantly, making our services accessible to folks who, for whatever, coming to our town or location is a barrier. Oh, how does it do that? All right. And how? So you might be asking, okay, what are you folks doing as it relates to the COVID vaccine efforts in these community pop-ups? So we've actually brought on board 15 what we call vaccine ambassadors. And I don't have the Lighthouse data that talks about the various census tracts, and which really gets very granular, maybe too granular for a presentation like this. However, these vaccine ambassadors are in areas, they either live in areas or are part of networks that can help us increase vaccination in the various, not only age groups, but areas where it's been lower. I mentioned earlier in the presentation, particularly the four corners of our county. And these folks are we're working like 10 hours a month to help us with education, to help us really get a better sense of how we can get vaccine to folks. Or what I should say is that how can we as a health department give folks who are not yet, or even pre-contemplative, where they're vaccine hesitant, how can we give them the information, the factual information, to help them make the decision to get the vaccine? Because I want to be really clear here. As a health department, our goal is to get people vaccinated. And so we're really trying to use this community partnership model to do that. And these vaccine ambassadors are helping us do that. And then we have community health workers, and those folks are working more than 10 hours a week. Several of them are full-time with us, who are helping with things like interpretation here at our clinic that we have here at Towner every day. We have a lot of our residents who come in where English isn't their first language. And so we need to have those resources available. And so the community workers that we just hired particularly are folks who are Spanish speaking and Arabic speaking. And so that's been a real asset to folks who have come to the health department here at Towner for the first time. And it makes them feel, it makes the whole process and the experience for them a lot easier and more intimate when there's someone here that actually speaks their native language. And then we have our entire equity outreach team, of which our community health workers and our vaccine ambassadors are a part of. And so that, in addition to the 4 full-time health department folks who work here, so it's all a big team. So with our vaccine ambassadors, we have a total of 15. Community health workers working on our COVID outreach support, that total is 5. And then the 4 full-time folks that we have here at the health department. And that is the end of my presentation. I'm going to stop sharing my screen and ask if there are any questions. Well, either this is a very shy group, or I've done a really good job of talking about where we are right now, or it could be C, none of the above.
As Charles, I guess I would go with C. I would just say at USUM, we obviously cover a multitude of counties, and I cover Washtenaw County as part of my portfolio, and just want to commend you guys. You guys are doing a great job at just having all those pop-up events and having constant communication. So it makes sense why you guys are leading the state in effort. So well, give you some kudos.
Aaron, thank you for that. We've learned a lot about our practice during the pandemic, in all honesty. And some of it has reinforced our practice in terms of some of the things that we've traditionally done. But in all transparency, it's also caused us to re-examine some of the things that we don't do as well. And one of the things that, and I mentioned this earlier, is having the resources and the ability to take our services to communities where they're needed the most, because most likely those are the folks who are going to have a hard time coming to our physical location here at Towner. And so I'm really proud to say that you saw, I didn't make mention of this. I didn't have my little clicker with me that allows me to go back and forth, and it was very difficult doing that with the mouse. But I would have gone back and talked about, there was a slide that had a photograph of our community van. During this pandemic, we were able to use some of our resources to purchase a van that has a lab on it. It's got an exam room. It has a bathroom. And so I'm so excited. This is like I said, I've been here for a long time. I've been here for 20 years. And now we have the ability, not only from a staff perspective, to be able to drive someone, but we now have the physical space that you really need to provide the type of services that we provide in neighborhoods, once again, where people need them the most. I'm reading the comments here, so appreciated. And you know, we look to partners like those who are part of Barrier Busters to give us feedback. This is great feedback, but please don't hesitate to give us feedback about maybe something that we could do a little bit better. We're constantly really trying to really attach ourselves or embed quality improvement in our practice. And that was prior to COVID as well. So if there are no other questions, thank you all so much for listening, and enjoy the rest of your afternoon.
Thank you, Charles. We're gonna hand it over to Kara Painter with Hawk, and she's gonna give us a quick housing funding update.
Thank you. Hi, everybody. Great to see everyone. Just want to give a quick Hawk update on where things are at. Currently, we have close to 1,000 applications for the SARA program. So we just ask that if you have clients who've applied for the program, just to have patience with the process. It is taking on average around 60 days for clients to work through the process. Also, just to let everyone know, if clients are stating that they're not able to get through to our intake line, that may be accurate. Our phone line has been inundated since last week, Friday, when the Ann Arbor Housing Commission sent out an email about emergency housing vouchers with our phone number on it. And so we've received around 800 phone calls within a 2-day period. So please have patience with us. If there is something that is super urgent and needs attention right away, please don't hesitate to reach out to me directly, either by email or calling me, texting me. I can make sure that if it's a really urgent situation that we're giving them a call right away. Does anybody have any questions really quickly for me about anything Hawk related?
Hey, Kara, can you put your email into the chat so people can pick it up?
Absolutely. I'll put all of my contact information in there. And please, as you guys know, for many of you that have talked to me previously, you can always feel free to reach out to me. I'm always available. So please don't hesitate to use my contact information. You're not bothering me. It's my job to be available for all of you. So don't feel like you're bothering me if you're reaching out. Any other questions? Thanks, guys. I will drop my contact information in the chat, and I look forward to talking to some of you soon.
Thanks, Kara. I'm just going to give a quick Barrier Busters funding update, and then we'll be free to go for the afternoon. So there is quite a bit of flexible funding still available. We have about $443 in our community donations right now. For the Greatest Needs Fund, we have $353, and then we have the Washtenaw County General Fund right now has about $40,000. So that's where we're about a little over $40,000 for our total flexible funding. This does not include CSBG or other block grant funding. Did anyone have any questions about that? All right, hearing none and seeing none, you guys have a great, oh, it was the CSBG number. That is a great question. When I checked this morning, it was at about 45,000 for both utilities and housing. If you'd like a more exact number, feel free to email me and I will put my email in the chat. Absolutely feel free to email me with funding questions. I can get you updated numbers. Were there any other questions? All right, hearing none and seeing none, you guys have a great afternoon. Enjoy the weather. We won't be meeting next month. Our next meeting will be in August. Have a great day.